Discharge planning and outcomes. So we've talked about this. Discharge planning starts day one of your evaluation. As soon as you begin any interaction with your client and with the caregivers, you're thinking about where they're going after they're finished with you. So those are the questions you need to start asking immediately of yourself and then, of the client and the caregivers. So when they're finished with you, what is a realistic discharge plan? Will they be able to go home based on their performance? So if you're in acute care, that is your role in acute care is discharge planning. Where do they need to go? Can they go home safely? Can they go home safely and receive therapy services at home? Can they go home and then receive outpatient services? Do they need to go to inpatient rehab, either acute or subacute? Do they need a discontinuation of services? Do they actually need you? And that is perfectly fine. You might walk into a room with a client that you have an evaluation referral, but they don't actually need your services, and it's fine to discontinue services after you've completed your evaluation. And then you're also thinking, what does the client need when they're finished with you? What DME might they need? So DME being bathroom equipment, shower chair, tub bench, 3-in-1 commode. Do they need adaptive equipment, reacher, sock aid, dressing stick, leg lifter, leg loops? What do they need? Do they need follow-up services? Should they see an optometrist? Would you recommend that they follow up with some sort of psych services? What do they need when they're finished in your care? Discharge planning and outcomes, they always have ongoing assessment. You're always reassessing your client. How are they making progress? Are they making progress? Why are they making progress? Why are they not making progress? Are they meeting goals? Do you need to modify your goals to meet the needs of the client, either grading up or grading down? So that reassessment is ongoing, because when you get to the end and you write a discharge summary and you note that the client didn't meet any of your goals, well, obviously the services that you provided were not very effective. Why is that? Is it because of the client, or is that because of the therapist? So always reassessing your client and adjusting and modifying based on their needs. And then what is a discharge summary? This is an overview of what they've done with you, an assessment of their progress. So within that, you will tie up how they came to you, how they left you, and how your services benefited them. You will identify if they met their goals or not, why or why not. You'll make disposition recommendations. Where are they going when they're finished with you? Because they can't stay here. So you've worked with them in acute care and they still need more rehab, but their progress has slowed down because their endurance is poor. So you're recommending a subacute facility for more lower level of care services. You were with them in acute rehab and they've done so well, but they still need therapy. And when they go home, they'll be safe at home, but they just won't be able to safely leave the house. So you're recommending home with therapy. They are ready to go home and they need intensive therapy ongoing, and you recommend home with outpatient. So these are the disposition recommendations you're making. You're documenting what DME you've recommended, what they've received, and what you continue to recommend. So or what you've ordered. So you might have issued them adaptive equipment. You might have ordered them a hospital bed and a lift, a patient lift, and some bathroom equipment, you might recommend, but it's an out-of-pocket purchase, a more specialized piece of equipment. So depending on insurance, insurance may not pay for a tub bench. So that would be your recommendation, that they need a tub bench to be safe to take a shower. And then you are documenting what education and training you provided to both the client and the caregiver. Education and training includes ADLs. It includes functional mobility. It includes how to use adaptive equipment. It includes energy conservation. It includes sex and intimacy training and education. It includes nutrition. It includes resources in the community. It includes home exercise program, passive range of motion, what education and training, hands-on training and verbal training that you did to both, with both the client and the caregiver. And that, remember, all of that discharge planning starts as soon as you walk into that room with the client. Where are they going to go when they're finished with you? And again, we will continue to go over that and really flesh up your understanding of what all of that means. And of course, if you have any further questions, don't hesitate to reach out.